I am Dr. Vamsidhar Kedar. I am a consultant pediatrician, pediatric intensivist, and allergy and asthma specialist with Lotus Hospitals for Women and Children in Kukatpalli. So today we have a discussion about the monsoon problems along with developmental milestones. I do hope that everyone gets a good idea about it on India on TV. I would like to thank the India on TV to give me this opportunity to discuss about these burning issues as of today. There is a lot of confusion existing among parents about the developmental milestones because comparison occurs over here. Usually every parent tends to compare their child with the other child. So I would like to emphasize here the developmental pattern is different from child to child. No two children will follow a same developmental pattern. If one particular child stands and walks at one particular age, the another child might stand and walk at a different age. But ultimately, achieving the final milestones of standing, walking, running are more important than individual milestones. We have a lot of milestones that we usually check in our day-to-day practice. Usually, milestones are checked at 6 months, 12 months, 18 months, and 2 years. The most importantly, what I want to make a point here is the growth pattern. Usually what we find in the children is a normal newborn is usually born between 2.5 to 3.5 kilos. Anything less than 2.5 kilos is called as a low birth weight. Anything more than 3.5 or 4 kilos is called as a large for gestational age babies. So 2.5 to 3.5 is the ideal weight of every newborn child. A 2.5 to 3.5 kilogram child on an average at the end of 12 months reaches an average weight of between 8.5 to 9.5 kilos. So the average weight gain during the first 12 months is somewhere close to 6 to 7 kilos. Gradually, as the child enters the 13th month, from 13 to 24 months, the average weight gain is nearly 1 to 1.5 kilo and not more than that. So the parents are usually upset by this particular typical growth pattern where the growth is either static or flat but does not show a significant growth when compared to the first year. In first year, they are usually habituated to see the child gain 6 to 7 kilos, and from second year onwards till 5th to 6th year, so the body weight only increases by 1 to 1.5 kilo, not more than that. This particular growth pattern is quite normal. Just on a lighter side, just imagine a child gaining 6 to 7 kilos every year till 5 years. The child would be around 35 kilos. It doesn't happen like that. So in the first year, on an average, the child's weight is around 3 times the normal birth weight. According to standard medical calculations, the least weight that can be expected is twice the birth weight at the end of 6 months and thrice the birth weight at the end of 1 year. And even the length. At birth, usually we roughly assume that the child is around 48 to 50 centimeters, and at the end of 1 year, the child's length would be around 75 centimeters. And then in the second year, there is only an increment of 12 centimeters. In the third year, there is only an increment of 6 centimeters. So as the age increases, the growth velocity actually remains flat, or there is a slight decline in the growth velocity when compared to the first year. This should be broadly kept in mind. And the developmental milestones are classified as gross motor milestones, fine motor milestones, social milestones, and language milestones. So here at every 6 monthly interval, we check the milestones at 6 months of age, 12 months of age, 18 months of age, and 24 months of age. Basically, this particular developmental milestone assessment is usually done to see whether there is an appropriate brain growth for age, or rather age appropriate brain growth is visible in the child or not. So coming to the 6 months, what we usually see is that in gross motor milestone, the child should be able to sit alone. In fine motor milestone, the child should be able to pass on an object from hand to hand. And in the social milestone, the child should be able to feed self with a biscuit, either crudely or softly. And the language milestone can be assessed as the child's usually turns towards a voice. Non-achievement of certain milestones above a certain age period is regarded as clinically significant, and a complete neuroevaluation is usually done, beyond which an early intervention can be taken up so to prevent a lot of other complications. At 1 year of age, basically the gross motor milestone is to stand alone. The child should be able to stand alone at the end of 1 year, and there should be a nice pincer finger thumb grasp, like we adults hold a pencil, to hold something which is kept in the middle of the fingers. And the child should be usually able to drink a cup, either if it spills a little bit or doesn't spill a little bit. And at the end of 1 year, he should be able to say a bisyllable words like mama, dada, etc. At 1.5 years, the child should be able to walk up to a few steps. He should be able to build a tower of few cubes, and he should be able to help the parents in simple tasks like get the spoon, keep the spoon, and they should be able to at least combine two words in the native local language. At 2 years, the child should be, by the time the child becomes 2 years and enters into the 3rd year, the child should be able to at least pedal a tricycle, and by holding a pencil or a pen in the hand, they should be able to draw a straight vertical line, and the child should be able to play interactive games with the parents and the known faces, and they should be able to tell at least a 2-word or a 3-word phrases. Now, care should be taken to assess the developmental milestones here, because no two developmental milestones are achieved at the same age for two different children. No two children are alike. So care should be taken in such a way to compare two children. The developmental milestones are tailor-made and age-specific and child-specific and very much child-centered. Care should be taken to produce as conducive domestic atmosphere as possible and as conflict-free atmosphere as possible to enhance the very good brain growth in the child.